So welcome everyone to this session today on a very critical topic, which is around salt, sugar, and ultra-processed foods and its effect on pediatric health, specifically around kidney disease. Thank you to Kidney Warriors Foundation for coming up with this topic and wanting to address this critical issue. There seems to be no clear data in terms of CKD incidence, but given the increase in type 2 diabetes and hypertension, there's definitely a huge risk of chronic kidney disease increasing. But we will talk about that with our panelists as well. So I'm very pleased to introduce our two panelists. We have with us Dr. Rajan Ravichandran, who is one of India's most renowned nephrologists and who has treated more than 20,000 patients, more than 1,000 transplants. He's also chairman of Sapiens Health Foundation and is passionate about the cause of the effect of high salt and how it affects kidney patients. And specifically, he's concerned about seeing younger and younger patients, affected by this. We also have with us Dr. Arun Gupta, who's a pediatrician and now since 1991 founder of Breastfeeding Promotion Network of India. He focuses on policy analysis regarding support to breastfeeding women, child nutrition and conflict of interest. And he is very strongly committed to policy changes around ultra-processed foods. And I am Aparna Mittal. I'm the founder of PatientsEngage, a platform that informs, engages, and empowers patients and family caregivers of chronic conditions. We believe that informed patients make better decisions for better quality of life, and they can also learn from experts with lived experience. So let's get started because we have a lot of ground to cover. Dr. Rajan, first off, are we seeing an increase in CKD and why do you focus on salt? Why do you think salt is a big area of concern?
Yeah, so definitely CKD incidence has been going up, and that's because our diagnosis of CKD itself has changed. Now we were with imprecise test of just estimation of a creatinine for diagnosis of kidney disease. Now we go with the estimation of the eGFR. So we are able to identify even people who have impaired kidney function. So several studies have now shown that in the general adult population, almost 10% have a reduced renal function. So the diagnosis is definitely better. And of course, as you said rightly, hypertension, diabetes, and other chronic conditions which contribute to CKD have also gone up. So drug therapies, environment, toxins, even pollution has been shown. Air pollution has been associated with a reduction in renal function.
Correct.
So you find definitely the incidence of CKD going up. So it's of great concern. And salt has a very important role to play. People think it just produces hypertension. It's not just hypertension alone. It can affect the vascular or the lining of the blood vessels, the endothelium. So the endothelial dysfunction starts even much before blood pressure can go up. Right. So I think salt is a very important concern for chronic kidney disease.
And just on that, and this came up in one of our early discussions, do children need the same level of salt as adults?
A very interesting question. See, children, you should understand when the child is born, the kidney function is not normal. It is not the adult's kidney function. So the salt that we take is essentially removed through the kidneys.
Right.
So the way in which we estimate somebody's salt intake is doing a 24 hours urinary salt or sodium, what we call. Then we know how much salt you're taking. So almost all the salt you consume is removed from the body by the kidneys. Right. And the kidney function is not optimal in the first year of life, and slowly it increases over a period of time and they get the adult kidney function. So obviously, the salt handling by the kidney is also going to be less. So the child requires less salt than the adult. For that matter of fact, in the first year of life, no salt should be given at all. And subsequently, almost 0.5 grams per year By the age of 12, the adult requirement of 6 grams should be reached so that the kidneys are not taxed.
Right, right. And you kind of alluded to it, but what is the effect of excess salt in the children's diet? I know you said that the kidneys are not developed, but what happens as a result from, because we'll have lay persons listening to this, right? So
Yes. So two things. By giving more salt to the child, first and foremost, you are creating a habit which is wrong. So if you are going to train a child right from early days by exposing to higher salt, see, salt is a dominant taste. It
right,
saturates the taste buds. So the child requires more and more salt to appreciate the same taste. So you have made a bad habit to start with. So for lifelong, this person is probably going to take more salt.
right,
That's a great concern. The second thing is the medical aspect. Now, medical aspects, of course, everybody knows the relationship of salt to blood pressure. So if you can't get rid of the excess salt what you consume, the chance of the blood volume expanding, producing high blood pressure is there. In children, often we don't record blood pressure. Clear studies are not there as to the relationship between salt and blood pressure in children. But many people don't know what is the normal blood pressure also in children.
correct.
So they miss it. They think, the lay person thinks 120/80 is normal for a child also, which is
Right,
wrong. For a child, it could be as low as 80/60. So it
right,
could be much lower. We don't routinely measure blood pressure in the child. The other possible effects are you can affect the growth. See,
right,
when more salt is lost in the urine, it takes the calcium with it. In the adults, it can produce osteoporosis, but in children, it can affect the growth. Same way, you can form kidney stones. That's also possible. So there are other ill effects of salt which can happen.
Thank you, Dr. Rajan. Dr. Arun, can you kind of talk about the hidden sources of salt, and I guess also this links to the fact when you did campaign against infant food as well, but we'll come to the infant food later, unless you think it's linked to this topic right away. So if you can talk about the hidden sources and how what was that one of the drivers for your campaign on infant foods? I think you're on mute.
Yeah, thanks, Aparna, for this question. I'll touch upon the hidden sources of common foods being consumed rather than on the infant formula front, because that's campaign on the infant formula was more on the marketing side, and again
Right.
we are struggling to get the marketing on the foods which I'm going to mention now. For example, hidden sources include, on the top of my mind comes is the noodles, for example, right? Very commonly consumed food, very aggressively marketed, and most of the adults and children, and in particular, they are consuming noodles which has a huge amount of salt in it, which probably doesn't go noticed as per the requirement that Dr. Rajan said, that under 1 year no salt, we say even under 2 years no salt. And the point is that the how do you calculate it? That's a difficult thing for a consumer, for the parent also. So the only thing I can say is that take care, even a bakery product, for example, you are eating a biscuit, but it contains salt. So all these things have to be noticed only by taking a look at the label of the nutrients contents. Only then And there are other commonly consumed stuff like these days we are getting into the ready to eat foods in terms of canned soups. Soups have a lot of cheeses. The new kind of cheese has a lot of it. Pizzas and even breads. People consuming a lot of breads these days. All these do contain. I mean, when you get into the modern food system, then most of the foods which are available in the market, which we buy pack process, they do contain salt. I think we can certainly call it hidden sources because they don't appear to be salty foods.
Correct.
On the face of marketing, or on the face how they are presented to the people, and how people are eating without even knowing what content of salt these foods might be. And same is true about the sugar also. Sometimes that we consume those items, even normal food contains normal, sugar, which is the inherent component of a carbohydrate, and it leads to development of, the dissipates into the sugar ultimately. But we don't know that. So, so that's something which I think the people should consider when they are giving any food, in particular food which comes in packages and we buy ready to eat. Yeah.
Right. And leading on to the next question, which is really what are ultra processed foods, right? So typically we know packaged foods to some extent. We know the term junk food, but what are ultra processed foods? And I guess in a sense you've kind of touched on why it's harmful, but also, is there any data which is indicating, we know anecdotally that there's an increase in consumption, but is there any data on the increase in consumption?
Yeah, I think it's a very good question you are asking about ultra processed food. This is, I would say, this is something new. People are not aware of this term because it's only 10 years old. And I thank Brazilian team who actually devised a NOVA classification of food based on the processing, type of processing. So the food is categorized into 4 categories according to NOVA classification. So the classification group 1 is unprocessed or minimally processed foods, which means, for example, you are eating a fresh fruit or a fresh vegetable, or you are crushing your wheat into flour. These are minimally processing, and the all other things which you eat as food directly, real food, that comes into unprocessed category. The second one is, the category is the food which we have categorized as group number one. We use some kind of salt or sugar, whatever ingredient we use, we call culinary ingredients. So to make the food tasty, so we cook it, we use it. So that food is number 2. So in the order of safety, I'm saying in the order of being unsafe. So number 3 is processed food. Now every processing is not bad. Now here is like, for example, if you store your vegetables, you store your fruit like pineapple or peas or now so many other fruits, they can be stored, but one has to check the ingredient in which they are stored. For example, if it is a high sugar liquid in which they are stored. So if you are drinking that along with, then I think you need to be careful. But otherwise, it's not ultra processed yet, so it's a grade 3. Grade 4 is ultra processed. Now, what defines ultra processed is that these foods are made in factories. They hardly you can see a real food in them. They are aggressively marketed. They have an ingredient which we normally don't use in the domestic kitchen. For example, additives, for example, taste enhancers, something of,
emulsifiers and things like that.
So we don't use them. So this is very critical when we define a food based on its nutrient content, which is salt, sugar, and fat. It misses out these ingredients which are inherently harmful to health. So that is what constitutes a ultra processed food, is that this contains more than 5 ingredients on the package. If it contains more than 5, you can define it's ultra processed. It contains something which you don't use in the kitchen, it is ultra processed. It comes in sophisticated packaging and all that to make it more. So all that, what has been observed in the findings in India and other countries is, most of the foods which come as ultra processed, they are high in sugar or fat or salt. All of them. So nutrient wise also, these are bad. Now coming to the science of harmful effect. There is enough literature now available. It's like being gathered. Even randomized controlled trials have proved that the risk of ultra processed foods on, for example, it starts with overeating first. So the first control trial tells us that in a 15 days time, the both the groups, which one group was eating unprocessed, the other was eating the ultra processed foods. So the ultra processed group gained 900 grams. They
in
were
15
eating
days.
in 15 days. They were eating ad libitum, right?
Right.
So the point is this, that overconsumption, obesity, then diabetes, then diseases like the cardiac problems, frailty, and the even some allergic and asthmatic issues in children. So there's
Right.
every week I find a new paper coming up. Sometimes more than 2 or 3 papers on the risks of ultra processed foods from long-term studies in France, from long-term studies in US, Brazil, Australia, and there are now 8 or 9 systemic reviews now available, which show us that there must be some degree of policy which must address this harmful impact of ultra processed foods. Yeah.
Right. Thank you, Dr. Arun. Dr. Rajan, if you were also talking of some of the global initiatives which have been fairly successful in terms of reducing salt intake, would you like to kind of share, and what were the drivers for those initiatives?
So in about 64 countries in the world, either there is a voluntary or a legislation to control the salt intake or the food labeling.
Right.
And one of the important foundations is the World Action on Salt and Health, started by Professor Graham McGregor from the UK in 2005.
Right.
In our own foundation, Sapiens Health Foundation, we started in 2009. And so there have been campaigns first to create an awareness amongst people, the importance of salt intake and chronic diseases.
Right.
Of course, is to promote healthy way of controlling the salt intake and look at food labels to know what you're eating, how much salt are you eating. So this has been UK, where instead of numbers, they mention the signal labeling. So you have the red signal, you have the yellow and the green. Right. So if a processed food has a green label, you are fairly safe to consume it. Whereas if it is red, it warns you that it is high in salt intake. The same thing they do it for sugar and trans fat also. So this is a very important. So several countries, as I said, important country was Japan. Japanese people were eating excess salt. They were almost eating 18 grams a day. And this was 20 years back, and they had the highest incidence of strokes, brain hemorrhage. Almost half, and their incidence of strokes have come down. They are now much less than even India. The same thing, the latest study is from China, which happened between 2018 to 2021, which has been recently published. What they have done is they have substituted 25% of the salt with potassium. And they found that the incidence of heart attacks and strokes have been less by almost 25% if you reduce the sodium content. And of course, UK had a very good program on the bread, because as you know well, the Western people, the staple consumption is bread for breakfast, lunch, and dinner. So the highest salt intake was through the bread. And what they did was reformulation to incrementally reduce the salt. So they don't do it overnight. Over a period of time. If you do it over a period of time, people don't realize that the salt has been reduced. They think the bread tastes same 10 years back and now in the UK, but it is different. Actually, they have come down by almost 20%. And they have found that the heart attacks and strokes have definitely come down. So several countries, as I said, almost more than 64 countries have some sort of either voluntary or legislation. The latest one is in the US. US has just issued a warning after the COVID epidemic that what we are going to face is an epidemic of chronic disease, result of hypertension due to, this was a huge study done in the Lancet, and which showed that almost 50% of the adult population are having hypertension. So they reduced. To that extent that in New York, a couple of years back, even in the restaurants, they have a red flag marked wherever there is high salt in the food. And of course, most important in these countries, especially in the US now, children food, whether it's school or everywhere, the salt has to be regulated, not just salt, sugar, and trans fat. So
Right.
there are claims to the manufacturers. Even our own foundation, we wrote to 300 manufacturers requesting them to reduce the salt content over a period of time. Like what Dr. Arun Gupta said, very rightly, the biggest culprit we found was the instant noodle. And in many places, that is the food that is available through the day.
Correct.
Dinner, they travel on the roadside. Previously, they were eating in dabas. Now
Right.
they have stopped eating in dabas and they're consuming instant noodles.
Or the dhabas are selling instant noodles.
Yeah, instant noodles, absolutely. So fortunately, we wrote to 300 food manufacturers, and the instant noodle manufacturer, one of the largest manufacturer in the country, responded to us, and they have brought it down by about 10% the sodium content. So I think it's only more effort that we have to put in and make people more aware. Yes.
The one other thing I remember you mentioning, I think was it, I don't know which of you, but the most of the labels will indicate sodium and not salt, and then the human or the consumer reads it wrongly.
Absolutely. This is again a confusion. See, for a layman, he can't differentiate sodium from salt. Normally, when we talk of salt, it is sodium chloride.
Right.
So 1 gram of sodium is equivalent to 2.5 grams of salt. So it should only be labeled as salt, common salt. So that because the WHO permits only 5 grams, which is very less, I think we can't achieve that target at all. It's very difficult. What we are trying to push is at least reduce by 25%. Whatever you're consuming, that's going to have some beneficial effect. But bringing down to 5 grams is not an easy task. But first, they should understand what is 5 grams.
Correct.
Now, it should be as salt and not as sodium. So somebody will get confused. If it mentions 2 grams of sodium, you will think you are eating only 2 grams of salt. No, it is 2.5. It is 5 grams.
Right.
So please have the label only this. We wrote to the government of India that this should be made uniform. The labeling should contain only salt and not sodium. Don't create this confusion between sodium and sodium chloride.
Right.
Yes, this is very important.
Right. So yeah, it's obviously important to our listeners to understand that as well, that, if it is showing 1 gram of sodium, it's actually 2.5 grams of salt.
And another clarification which I would like to make here is a bit humorous, that when I tell a person out, when they read that their permissible level of salt is 5 grams per day, they think it is in addition to whatever food they're eating, they can eat up to 5 grams. They have to understand that this 5 grams is from 3 sources: natural food, salt added during cooking, and processed food. Right. All 3 put together, it is 5 grams, not just the 5 grams of salt that they have added on the table. So one of our biggest campaign is get rid of the salt shaker on the table. We have approached all restaurants. We tell them, please don't keep the salt shaker on the table. If the soup comes, the habit is not to taste it. Directly they add salt even without tasting. So give them an opportunity. Only if they ask for their poison, you should give it to them, not otherwise.
Keep only pepper shakers.
Absolutely.
Right. So Dr. Arun Gupta, your organization has focused and continues to focus on policy changes. What do you think, should be the focus in terms of policy change? Obviously, there's been some talk of food labeling, etc. But what do you really think should be the focus?
Let me add on the answer to your previous question before I ask for this, because there has been studies done by the Euromonitor International. They monitor the market for consumption patterns, so the point of sales. So the India data we have analyzed from there, it says that the solid food, ultra processed food has grown from 2 kg per capita in 2005 to 6 in 2019, and expected to grow to 8 kg per capita by 24.
Sorry, so this is per day, per month,
annually, per capita.
Annually. Okay.
So, secondly, about the beverages. the sale of beverages has gone up less than 2 liters in 2005 to about 8 liters in 2019 and is expected to grow to 10 liters by 2024. So per capita means you divide by the population.
Correct.
Totally half of them don't eat it, but
Correct.
it's an average of per person consuming. So
Right.
that's a concerning thing. Of course, we are not there as US or UK. More than 50% consumption is ultra processed food, which has in some countries are at 20%, in some countries are at 25%. So that's why we have started working hard in India to plug it right now. And gaining our experience from the infant food, we use the same argument of health that infant food, infant formula was declared unhealthy for the children, for both for undernutrition and now even proved for overnutrition. Both same the health on the health ground. There is enough data on the table, including WHO recognizing that there is a problem, but the problem is that the powerful industry doesn't allow us to make the policy. So
Right.
that's pushing us to tell people to eat right. They are pushing us to do exercise as a policy.
Right.
So, which I strongly, I'm not saying that it's bad to do exercise, but they are not the solutions to the problem. The solution to the problem lie in two policies here. In particular, when we talk about ultra processed foods, whether it is high salt, high sugar, or high fat, bad fat, I would say, lies in a strong warning label on the package itself. So,
Right.
according to our studies, we have found the same companies who used to sell tobacco, they bought food companies many years back, and they've given their strategies to them. And scientists, buying NGOs by funding them, creating their own network of obesity, so they are creating an alternative paradigm shift from the current thinking and impress upon the government that it's not that bad.
Right.
Policy which we are demanding now, and the second which we are going to highlight in our demands, and we have started working on it, is also in our writings, is a policy on regulating the marketing. Regulation of marketing requires a direct ban on the television marketing targeted to children and adolescents. That is point one. And all marketing would be our dream, but that is probably not going to happen. But we are saying even if it is like hours, after 9 or something, that the industry may be allowed to do. But whenever you give proviso to industry, they exploit everything. So there are studies which clearly show that it is the consumption is driven by the marketing.
Correct.
It's not something that only depends on, as Dr. Rajan said, of course we are driven by our taste buds, no doubt about that, but it is the marketing which is driving us to consume more of ultra processed foods based on the convenience and the selling techniques which they use. Yeah.
Right. Thank you, Dr. Arun. So, Dr. Rajan, obviously you've talked of food labeling. Dr. Arun's talked of food labeling. Talked of advertising, limiting advertising and marketing, especially those targeting children. How can all of us come together to create a call of action or to get more momentum? Obviously, panels like this will help. Dr. Arun's team writes, it's writing more and more in newspapers as well. But, can we come together with a call to action and see how we can kind of create more momentum around this and, kind of push the needle?
I think we could identify people who are interested in such ventures. Then first do some research as to see what is for example, the salt intake for such a large country of ours, only 1,000 people have been studied from very different cultures, I would say. So then consumption in different parts of India. So we require to identify key persons all over the country. I think we should keep them as fulcrum. And then through that, we can do studies. We can push in media propagation, and of course, we can then push the government also for certain legislations like regulating kid meals and the food labels. Yes, I think we should identify like-minded people and do this.
Right, right. Thank you, Dr. Rajan. Dr. Arun, anything that how do you think this panel and the fact that Kidney Warriors addresses a large population of kidney patients and, they themselves are passionate about this topic, how can we all come together to support this, support what you're doing? Yeah.
No, one of the areas which this question we discussed in a couple of meetings we had with the academy in the country, as well as the people who are working on nutrition and health in public health area, and also highlighting the areas of conflicts of interest. So we have we concluded that we could have a small network which will work in this area. Like we have a organization, not an organization, I would say a small alliance of called Nutrition Advocacy in Public Interest. So we're very strongly opposed to any partnership with conflicts of interest where people are funded by industry or its partners or the front organizations of the industry, whichever. So we keep a very arm's distance from them, and we don't interact much with them. We gave a call to the people who were in that. More than 300 people participated in the discussions, and 100 people have signed up to what we are now calling as a PHNA, is the Public Health and Nutrition Advocacy Group.
Right.
Address into which areas they are interested in. For example, somebody is interested in sugar policy, somebody is interested in conflicts of interest. So we are trying to frame that group into more formal group for advocacy, to sign off campaigns, to sign off letters to the Prime Minister's office or Health Minister's office, something like that. This, including the Food Safety Authority, we are planning meetings with the Food Safety Authority. So I think we all, that's where we all can join in terms of, and if you are, if your group or the kidney group, or they are going to give a call, so we should do reciprocate from our side to that group in terms of sign up campaigns or whichever way we would like to call it. So there are people are yet not calling upon. The current focus in our groups, which I have observed, is on front of pack labeling, and a lot of institutional demand, like AIMS as an institution, the All India Institute of Medicine from several states, like that on 15th there is one from Jharkhand, and I've seen many of them. I've not been able to attend all, but many of them, they are giving calls. So consumer groups are getting together in this consumer group called Voice, and there are several others who are representing they are representing in the Food Safety Authorities working stakeholder group. So we are trying to meet them and influence their. So we are not part of the Food Safety Authorities group as such. So that's how we are going to demand policy through newspaper articles, as you rightly said. The voices do get heard in that sense. So that's the plan currently, and we should be open to any further discussion on these partnerships.
Great. Thank you, Dr. Arun. So I think we are up for time. Thank you to both Dr. Rajan and Dr. Arun. I think we have a few clear messages and take homes. So as consumers of products, we should all become smart and learn to read labels, understand labels. We should all be demanding better labeling from all providers, right? And one is the packaged foods, even the home delivery of products now, even like your Swiggies, etc. Right? You need to start demanding that what exactly is in that as well. And I think whatever we can do to increase the momentum and the voices around calling for more research, calling for public awareness, as well as labeling and marketing restrictions, I think is all going to be in our own interest. So thank you once again, Dr. Rajan and Dr. Arun, for your time. And thank you, Kidney Warriors, for facilitating and coming up with this topic as well.